These primary school gates in Haringey in London will stay shut on Monday. They had been told they must welcome children back until the Education Secretary Gavin Williamson had a last-minute change of mind and said every primary in the capital should stay closed. His department said the instruction was a last resort to help suppress the spread of the virus in the community. But schools in the many other Tier 4 areas are nervous about the rise in COVID too. And the country's biggest teaching union says there should be a fortnight's closure across England.
Close schools now for a limited period of time to allow the viral levels to become lower in children and young people, and for schools to be able to take further precautions to open safely.
Are you telling teachers not to go back to their classrooms on Monday?
They have a legal right under employment law for working in a safe environment, and if they don't feel that is the case, then they have the right to exercise that right.
But some argue a blanket closure of schools would leave children even further behind, and they should open, but with the promise of much greater protection for teachers and children.
I'd like to see teachers made a priority, and teachers and support staff made a priority for the vaccine, because that will keep them safe and mean less school closures. I'd like to see mobile units up and down schools around the country where we can roll out the testing and vaccinations around schools efficiently and speedily.
The Education Secretary Gavin Williamson's been accused of chopping and changing on school rules too many times during the pandemic, with U-turns on how to decide exam results to wearing masks between classes. Teaching unions say he's failing to keep up with the virus. In mid-December, the ONS estimates 1 in 50 children aged 2 to 10 had COVID, and 1 in 33 secondary school-aged children were infected. One professor in public health has a novel idea for tweaking the school year to lower the risk.
Why can't we shift the school year, push it back a bit, have the equivalent of a summer holiday now to control the infection, and then extend school in the summer. And that is also easier to apply public health measures of, maybe teaching in fresh air and ventilation of classes, etc.
The transmission of the new COVID variant tripled in November, feeding through now into very sick people arriving at hospitals, often without enough beds or staff for them all.
When you have a patient in an ambulance outside your department that you can't get in because there isn't a space to look after them safely, it is incredibly stressful and frustrating, because you've got two things. You've got the patient in the ambulance who you can't look after, even though you know that they're actually probably quite sick and they need looking at. And then at the same time, you also realise that you've got an ambulance that can't go to somebody who's had a heart attack or been in a serious car accident.
COVID cases are breaking unwelcome records every day. The pressure and the debate over what to do next are building.